Morning, one and all. Today's topic is properties of cardiac muscle. Cardiac muscle has 14 properties: automaticity, rhythmicity, conductivity, contractility, excitability, distensibility, long refractory period, functional syncytium, extrasystole and compensatory pause, all or none law, staircase phenomenon, length tension relationship, frequency force relationship, load velocity relationship. Let us see each one briefly. Automaticity. See, word itself defines that automatic means its own beating without innervation by any other nerves. It has the ability to beat by itself. Automaticity is the property of automatic beating of heart. Heart continues to beat even when it is completely denervated or isolated. See, even if we remove heart from a man or from any animal, after some time, uh, it will beat its own. Even though the nerve supply is denervated, it will be beat. It has beating. So this is called automaticity. The ability of the cardiac muscle to continue to contract regularly even in the absence of its nerve supply is referred to as automaticity. See, even the nerve supply is not present also, the heart itself beats. So this is called automaticity. This is possible due to okay, this is possible due to the spontaneous generation of impulses by SA node, the primary pacemaker of the heart. See, SA node is the primary pacemaker. This automaticity is because of this pacemaker impulses sent by this pacemaker, that is the SA node. In some cases, if the SA node does not work, then AV node, and if AV node does not work, then the Purkinje fibers may act as the pacemaker. Okay. Automaticity is also a property of the potential pacemakers of the heart, like AV node, is Purkinje system, ventricular muscle, etc. When SA node fails, AV node. If even though AV node fails, Purkinje system. All this have the pacemaker property, and the primary pacemaker is the SA node. Then rhythmicity. See, automaticity is the automatic beating of heart. This beating is also occurring rhythmatically. So this is called rhythmicity. Heart not only beat automatically but also rhythmically. Rhythmically refers to rhythmic excitation of the heart. This is called autorhythmicity. See, automatically and rhythmically. So it is called autorhythmicity. A normal heart beats in a perfectly regular rhythm as interbeat intervals remain virtually constant. See, in between the interbeats, it will remains constant. This is occurs due to regularity in rhythmic discharge of pacemaker, which is normally SNO. How this rhythmatically occurring is because of this SA node. SA node discharge rhythmically, so heartbeat also occurs rhythmically. Thus, heart rate is the function of rate at which pacemaker generates the impulse. SA node is the primary pacemaker of the heart as the excitation begins in the SA node. Okay, it is a primary pacemaker because excitation starts in the SA node. Then the rate of discharge of SA node is 60 to 100 per minute. The highest is among all the pacemaker. Therefore, the normal heart rate is 60 to 100 per minute. Okay. This pacemaker only causes the automatic breathing and rhythmic beating. So the pacemaker SA node automatically rhythmically beats, which helps to produce 60 to 100 beats per minute. Only it will be decreased or increased only in the diseased condition. Next property is the conductivity. The cardiac muscle conduct impulses generated in the heart. See, conductivity from conductivity word itself defines a conduction. See, in if we take the heart picture, like um, if we see the SA node here, then there will be the AV node. The impulses from the SA node reaches the AV node. From the AV node, the ventricular muscle and this Purkinje fibers, right? See, from this, it will passes here. This causes the atrial contraction, and from the AV node, it passes to ventricular muscle. This causes ventricular contraction, and from there, it will passes to the even the Purkinje fibers. This helps in whole ventricular contraction, right? So this is the conductivity. The cardiac muscle conduct impulses generated in the heart. Impulses produced in SA node is conducted by specialized conducting pathway to the ventricular muscle. The impulse then spreads rapidly in cardiac muscle to the different parts of the heart. See, from there it will passes all over the heart. Cardiac impulses are described in the next chapter. See, one separate question is there for the conductivity of heart. We will discuss in next chapter. Cardiac muscle contracts in response to a stimulus. In fact, heart contracts regularly and rhythmically in response to impulses generated by the SA node. How the SA node generate the impulses in the way the heart will get contracts and the heart will conduct their impulses, right? Okay. Then excitability. See, excitability. Excite means heart show excitability when the impulses are generated. Cardiac muscle is an excitable tissue like nerve and other muscles. Excitability is the ability of the cardiac muscle to respond to different stimulus. See, we will give stimulus to the heart, right? A pacemaker sends the stimulus to the AV node. From there, it will pass all over the heart, right? That time the cardiac muscle shows excitability. Excitability is shown only when there is a sufficient stimulus. Okay. Cardiac excitability can be altered by various factors like concentration of ions, hormones, and most of the importantly the state of autonomic activity, that is the sympathetic and parasympathetic tones. See, sympathetic and parasympathetic causes increased excitability and decreased excitability. This is seen in diseased conditions, right? If the excitability increases also problem and the decreases also problem. It is mainly depend upon the factors like concentration of ions, hormones, and most importantly the autonomic activity, that is the parasympathetic and sympathetic tones. See, you write the excitability definition and the factors that affects the excitability. It is very very important because how parasympathetic and sympathetic autonomic activity decreases and increases. This will be briefly discussed in next chapter, but the factors that affect the excitability you just mentioned there, this point. Okay. Then distensibility. Distensibility means ability to stretch, right? This is the ability to stretch. This occurs due to the compliancy of the cardiac muscle. The property helps in filling and of atrial and ventricular chambers. See, distensibility means stretching. Balloon, how the balloon stretches, like that heart also stretches. See, this helps in filling of the blood. When the blood reaches the atria through superior vena cava and inferior vena cava, this extensibility helps to uptake the blood and from the atria and it moves to the ventricles. The whole the cardiac cycle will occur. Next property is the long refractory period. See, long refractory period definition is very important. In Viva also, they ask why the heart get doesn't get tetanized, why the skeletal muscle and smooth muscle get tetanized. This is because the heart has a long refractory period, which does not make heart to get tetanized. Okay, tetanus means there will be no response even though the stimulus is given. Okay, that is called tetanization. Okay. Ventricular muscle has long refractory period. Refractory period of the muscle is a period during which muscle does not evoke a response no matter how strong is the stimulus. See, um, uh, they are saying that refractory period of the muscle is a period during which muscle does not evoke a response no matter how strong is the stimulus. See how long you stimulus, how strong and how long the stimulus you give, the heart does not show, heart muscle does not show any response. This is called long refractory period. It will be two type: relative long refractory period and absolute refractory period. These two are different, and they may ask definition of long refractory sorry absolute refractory period and the relative refractory period, and this is discussed in next coming chapters. Okay. Then in cardiac muscle the duration of action potential is almost same as the duration of mechanical response. The refractory period extends to the most of the part of mechanical response in ventricular muscle. Therefore, always a new action potential generates a fresh mechanical response. See, we have to understand this. When action potential occurs, then automatically heart shows the mechanical response, right? See, this action potential and mechanical response occurs simultaneously. Means mostly same time they will occur, but due to the long refractory period, the mechanical response the previous after the previous one only the new mechanical response occur. There will be no what mixing up of these two mechanical response such that there will be no tetanization. Whereas in the smooth muscle and skeletal muscle, these two mechanical responses get merges and means the two get mixed such that the muscle undergoes tetanization. In the cardiac muscle, there will be no merging of these two mechanical responses, so that there will be no tetanization. That's why the heart continuously works even till till death. Okay. Consequently, the fresh contraction cannot occur before the completion of the previous mechanical response. See, when if previous mechanical response if completed only, then the fresh contraction occurs. There will be no merging of these two contractions. See, thus the mechanical response of ventricular muscle cannot be merged, and therefore cardiac muscle cannot be tetanized. So that cardiac muscle cannot be tetanized because there will be no merging of the previous one and the fresh one, right? In skeletal muscle, mechanical responses can be merged and muscles can be tetanized as the duration of action potential is much shorter than the duration of mechanical contraction. Okay, means action potential just completes before completing only the mechanical contraction starts and the next one come, and it will causes fast responses and get tetanized. Okay, the next property is the functional syncytium. Cardiac muscle is a functional syncytium, means a whole cardiac muscle contracts at a time. Some part of the atria will sometime and some part of the ventricle. It will be not like the whole heart will get contracted at the same time. This is because of the functional syncytium property. The functional syncytium is mainly because of the gap junctions. See, cardiac muscle is a functional syncytium due to the presence of numerous gap junctions. Therefore, all muscle fibers contract almost simultaneously. Ex- Next property is the extrasystole and the compensatory pass. When a sufficiently stronger stimulus is applied in a relative refractory period in an experimental recording for normal cardiogram, an extra contractile response occurs. This is called extrasystole. See, extrasystole will be you can understand if you understand the afterload, preload, systole, and diastole in the cardiac cycle. Then when you listen to that class and then you come and read this, you can understand easily. Then all or none law. See, all or none law is the one of the main specific property of the cardiac muscle. See, all or none law, refractory period, functional syncytium, and the staircase phenomena. These four you should be very thorough so that you can attempt in the viva if they ask any question. See, the all or none law states that the magnitude response of a tissue to stimuli remains same irrespective of strength of stimuli. Means um, the response of the tissue magnitude of the response of tissue remains same even though you give the stronger the stimulus is very small. See, if I give with very force also, the magnitude of the response of tissues is, suppose if I take 50 is the magnitude. If I give the stimulus with 1000 times, also it show 50 only. If I give it 20 or 30 also, it shows same. This is called or none law. Okay, I think the example you can understand. See that the magnitude of the response of a tissue to stimuli remains same irrespective of strength of stimuli. That means the tissue responds, it responds optimally or it does not respond at all. When the stimulus is see, we have threshold stimulus and supra threshold stimulus. Threshold stimulus is the stimulus at which the cardiac muscle show the stimulus. So it is the optimum, means cardiac muscle have certain stimulus. When you certain strength, some certain threshold, if you will give that much threshold only, then it will show response. Below that also it does not show, above that also it does not show. So below that is called subthreshold stimulus, subthreshold strength. If we will give the stimulus below the subthreshold intensity, the cardiac muscle does not show response. If we will give a threshold stimulus, threshold strength, it will show optimum response. If we will give supra threshold stimulus, it will not increase its response because um, optimum is the only when the threshold intensity is given. Okay, it will be very clearly discussed in the amphibian chats during viva. See, when the stimulus is subthreshold strength, the muscle does not respond to it all. If the stimulus is threshold intensity, the muscle exhibits the optimum response. The height of contract does not increase following the application of suprathreshold stimulus. See, graph will be like this. See, if if this is the cardiac muscle you take, it has threshold stimulus some 50. Okay, subthreshold I gave 20. Means if I give 20 stimulus, the response of the muscle contraction or relaxation does not shown by this muscle, because 50 is the threshold. I'm giving less than 50. It is a sub threshold, so there will be no response. If I give 70, means greater than 50, it is called supra threshold, right? Supra threshold stimulus. But if we will take graph, if this is the threshold, means maximum stimulus, then sorry, if this is a threshold, I gave threshold stimulus, it will show optimum, then it will be normal. You if we will give 70, 80, 100,000, nothing, there will be no response, it will be straight line. Okay, this is the supra threshold stimulus. See, muscle will show the stimulus optimally only at the threshold intensity. It does not evoke any response during the sub threshold stimulus, it does not evoke response during the supra threshold stimulus. Okay, stimulus gives the response, right? So only threshold gives the maximum threshold stimulus only give the maximum response. So, okay, I think you got understand. The height of contraction does not increase following the application of suprathreshold stimulus. This is called all or none law. Next is the staircase phenomenon. See, staircase phenomenon means the previous one causes the beneficial effect to the next response. Means I will explain upcoming. Like, sorry. If a quiescent heart is stimulated repeatedly, keeping the interval between the stimulus just less than 10 seconds, the magnitude of the first 3-4 contractions progressively increases. See, the contraction of this muscle will be increased ongoingly, because the previous 3-4 contractions causes the upcoming contractions to be performed earlierly, fastly and earlierly. Okay, this is called staircase phenomenon. It appears that staircase phenomenon violates the principal law, but it does not. In fact, it does not, because each stimulus alters conditions for the next stimulus. See, if you have idea of this muscle contractions, see, we have sacroplasmic reticulum, right? It will releases calcium ions. These calcium ions bind to this excuse me, troponin C. All that process will be discussed in the muscle contraction. See, from the sacroplasmic reticulum, the calcium released during first contraction, right? Then, if the second contraction occurs with below the 10 seconds magnitude, the calcium will not be returned back as fast as the before the second stimulus. So that what happened, the leftover calcium and the newly releasing calcium for the second contraction, these two mix up, so that there will be increased contractions, right? See, this is the sacroplasmic reticulum. This releases calcium ions. Okay, first contraction is completed. If the second contraction occurs fastly within below the 10 seconds, the calcium that are returning to the sacroplasmic reticulum are used for the second contraction, and for the second contraction also there will be release of calcium ions. No, these calcium ions that releasing for the second contraction and the previously left calcium ions, these two causes the increased contraction. Okay, and this is the three reasons for this staircase phenomenon. One is the increased calcium ions. This is a beneficial effect. See, previous one benefiting the second one, so this is called beneficial effect. Next, enzyme activity. Due to the frequently if contractions occurs, there will be increased temperature, right? Increased temperature, what it causes? Increased enzymatic activity. So there will be increased enzymatic activity. Increased enzymatic activity increases the contraction, right? Then, due to the increased temperature, there will be decreased viscosity of the sacroplasm. Sacroplasm is this, the sacroplasm viscosity will be decreased, so that the contractions will occur fastly. Okay. This is the staircase phenomena. Next is the length force relationship. The force of contraction is directly proportional to the initial length of the muscle fiber within the physiological limit, which is known as Frank-Starling's law. See, the Frank-Starling's law is very important question for even the 3 marks. And also they will ask in Viva. See, you just remember the definition. The force of contraction is directly proportional to the initial length of the muscle fiber. Uh, Initial length means not the length, means prior to the contraction. Before the contraction, the length that only determines the force of this contraction, right? Next, the frequency force relationship. Increase in force of contraction due to the increase in heart rate is known as frequency force relationship. See, force of contraction increases the increased heart rate, right? This is the frequency force relationship. It is also called known as Bowditch phenomenon. Important, they may ask in Viva. Okay. Increase in myocardial performance is restricted to a limited increase in frequency. Why this is occurring like this will be discussed in cardiac output. So next, load velocity relationship. Velocity of uh, shortening to the load imparted on muscle with which muscle contracts is called a load velocity relationship. See, here we can understand that it is inversely proportional. The velocity of contraction is inversely proportional to the load that acts against it. The velocity of muscle shortening or contraction decreases with increasing afterload. See, afterload and preload will be discussed in cardiac output. Um, See, you just remember that the shortening, the faster, the lower the loads, and the slower with the higher loads. Means um, shortening velocity is maximum when there is no load. See, the velocity will be shortened maximally when there will be no load on the muscle. Okay, that's it. Thank you.